Okay, my name is Matthew Miller, and this is my fourth oral annotation. Um, I'm going to be annotating the journal "Collective Efficacy in Obesity: The Potential Influence on Social Factors on Health." So the argument of this journal states that much less is known about which characteristics of communities may lead to disparities in health outcomes. Collective efficacy, the willingness of community members to look out for each other and intervene when trouble arises, is a social factor shown to be associated with outcomes related to obesity, including premature mortality and cardiovascular disease. The objective of this study is to determine whether neighborhood collective efficacy is associated with individual measures of BMI in adolescents. So going on to the method, it says that we use a multi-level cross-sectional survey in Los Angeles County involving 807 adolescents in 684 households in 65 neighborhoods, in addition to a sample of 3,000 adult respondents. The main outcomes measures are BMI at risk of overweight and overweight status. Using a two-level model, we find significant relationship between the collective efficacy and all three outcomes, net of levels of neighborhood disadvantage. Going on to the evidence, it states, however, while obesity is found in all income and ethnic groups, low-income groups and ethnic and racial minorities are disproportionately affected. This disparity points to social factors as likely contributors to the obesity epidemic. The findings are located right here. These models indicate that about 7.2% of the variation in BMI and 5.7% and 3.3% of variation in risk of overweight and overweight, respectively, is due to neighborhood level characteristics. In other words, the majority of the variation in weight status is still observed as an individual level phenomenon, while neighborhood level factors play a small but possibly significant and far-reaching role in determining variation in body mass. And then implications are found lower. It states that our study shows a significant relationship between a collective efficacy and each of our outcomes, BMI at risk for overweight and overweight status, suggesting that group-level social factors among adults are substantially associated with net energy balance of neighborhood children. And for the use, I think I'll be able to use this journal a good amount within my paper. However, it is limited because they are relying solely on cross-sectional data. It is valuable, however, because it does prove that there is a connection between social factors and physical health, and will work to answer my research question with that information. And that's it.